This solution is administered before a magnetic resonance imaging (MRI) scan to help produce clearer images for your doctor to diagnose your condition. It is classified as a gadolinium-based contrast agent (GBCA) and is specifically designed for use in MRI procedures. Before starting Gadobutrol 15 mol/15 ml, 1 mol/ml, intravenous solution, it's important to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your healthcare professional. This medication is administered by injection into a vein by a healthcare provider, following the directions given by your doctor. The dosage is determined based on your medical condition and weight. It's important to follow the dosage instructions carefully for the best results. If you experience nausea, an unpleasant taste, or a headache after taking Gadobutrol 15 mol/15 ml, 1 mol/ml, intravenous solution, talk to your doctor. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you outweighs the risk of side effects. Most people who use this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as changes in the amount of urine, pain/swelling/redness at the injection site, or swelling in the ankles/feet. Seek medical help right away if you notice dark patches on the skin, hardening/tightening of the skin, joint stiffness, hip/rib pain, muscle weakness, or trouble moving. Although rare, a serious allergic reaction to this drug is possible. Get medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. This medication has the potential to cause kidney damage, especially in individuals with existing kidney issues, elderly patients, and those with high blood pressure or diabetes. It is important for your doctor to assess your kidney function before administering this medication. Be sure to consult the side effects section for more information. Before using Gadobutrol 15 mol/15 ml, 1 mol/ml, intravenous solution, make sure to let your healthcare professional know if you have any allergies, especially to other gadolinium-based contrast agents. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, diabetes, or high blood pressure. Gadolinium, the active ingredient in this medication, can stay in your body for months or years after receiving it. Studies have shown no harmful effects from gadolinium if your kidneys are functioning normally, but it's best to talk to your doctor for more details. If you are planning to have surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, this medication may pass into breast milk, but it is unlikely to harm a nursing infant. It's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Gadobutrol 15 mol/15 ml, 1 mol/ml, intravenous solution. Certain medications may alter the effectiveness of Gadobutrol or increase the risk of experiencing serious side effects. It's crucial to keep a list of all the medications and products you use, including prescription drugs, over-the-counter medications, and herbal products, and share it with your doctor and pharmacist. You should never start, stop, or change the dosage of any medication without first consulting with your doctor. This will help ensure the safe and effective use of Gadobutrol. If someone has taken too much Gadobutrol 15 mol/15 ml, 1 mol/ml, intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it is crucial to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to remember not to share this medication with others. Before using this medication, you may need to undergo certain lab and/or medical tests to check your kidney function. Make sure to keep all your medical and lab appointments and consult your doctor for more details. This solution is used once before your imaging test. This medication is typically administered in a medical setting, such as a hospital or clinic, and is not meant to be stored at home. It is used as a contrast agent for magnetic resonance imaging, MRI, to help improve the visibility of certain body parts for diagnostic purposes. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific medical needs. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.